Good morning, everybody. I need to make this video because something happened over the weekend that I was thoroughly disappointed with the way that a particular person was going about trying to find relief for their lower back symptoms, and the way that the provider handled the situation based off the recommendation. So it went like this. Someone who's in their mid-30s, who's otherwise healthy, let's just say healthy, had debilitating back pain and associated sciatic pain running down their leg. Although it wasn't really sciatic pain, it was more like radicular referral pain from their lumbar spine. The person said, I can't go see my chiropractor until Monday. I'm in a lot of pain. What do I do? Well, that person got a recommendation to go to or consult their neurosurgeon based off of just their history of recurrent back pain. And then that neurosurgeon said, do not go see a chiropractor. Don't see a chiropractor, they're gonna make it worse. They said, come into my office and we're gonna start you on a regimen of physical therapy, injections, and then consult and see if you're a candidate for surgery. Okay, here's where I have a problem, guys. If you're in that much pain, okay, this, debilitating back pain to where you can't function in and out of the car, in and out of bed, hurts to go to the bathroom, can't, bend forward to wash the dishes, can't pick up your children, can't walk the dog. Terrible, debilitating pain where you are basically at the moment temporarily disabled, whether you know it, whether you want to admit it or not. You can't work, can't function. You got to be able to stand on your 2 feet, got to be able to not, bend and reach without being in debilitating back pain. Believe me, I know I've been there. You need to go see your recommended chiropractor. And why I say it like that, and this is the most braggadocious you'll ever probably hear me on my channel, outright like this without any hint dropping. Yeah, you need to see a chiropractor like me. Does that mean a Gonstead chiropractor? Not necessarily. What it means is that you need to find someone who specifically and confidently can say, I will get you out of pain. I know that if you come see me, we are going to get you stable in a very short amount of visits. No, that's not 20, 30 visit care plans, guys. It's like 3, 4 visits max. And that's because I've unfortunately the hard way learned and figured out why these discogenic, herniated disc, bulging disc, pressure on nerve, L4, L5 radiculopathy type of cases, why they cause the pain they do, how people present, and how to care for them. I'm gonna leave it at this. You cannot wait for something that may never even come, like a surgery, or sit on some injections that simply give the same amount of temporary relief as a chiropractic adjustment. Sorry, it's true. Or go to a chiropractor at the joint, hoping that they roll you on both sides and pop a couple of joints, and that's gonna get you better. It just doesn't work like that. You need to get a specific, thorough analysis, go over a very specific history, go over a proper orthopedic and neurological examination, get the proper imaging, okay, whether X-ray, MRI, or other, to find out where exactly is the nerve being irritated and how it's causing the pain that it's doing. How much discogenic, or I should say disc related pain based on the damage to the disc is causing this crippling, antalgic, lateral shift of your body where your pelvis is on one side of the room and your head's on the other side of the room because you can't stand straight and your back is crippled. This is what I specialize in. Outside of vertigo, this is what I specialize in. You cannot let your healthcare providers or your mind let you or lead you down the road of, oh, this is different and I need to go get surgery now or nothing. Oh, I need to go get epidural steroids and I need to get muscle relaxers and painkillers and all this other crap that just masks some symptoms and, to be honest with you, makes it much harder for you to heal, but that's another story, another video. You've got to find the right chiropractor. And like I said, if you need to, or I didn't say this yet, if you need to ask 5 friends, 10 friends, 20 people, family members, friends, hey, who's the chiropractor you went to? Anyone, please, a recommendation for when you or they were in, 10 out of 10 debilitating pain. Was somebody able to help? And if someone says, yeah, I think I know somebody, whether it's Dr. Pearlman or whether it's Dr. Bob, whatever, or Dr. Mary, whatever, it doesn't matter. Go see that person and get out of pain. Yes, it's possible. You've got to go to the chiropractor that knows how to approach those situations and get you out of acute pain, okay? That, if nothing else, is what chiropractors should own. It's what we are ready and willing and chomping at the bits and salivating to do, is to help give you back your quality of life as quickly as possible, as accessible as possible, as affordable as possible, because that's what I do. And I just wanted to put that out there because it's too important, and I don't want to see people making mistakes, and I don't want to see people following bad advice. All right, if you ever need anything, please feel free to reach out. It's Dr. Pearlman.